Welcome to this episode of Transforming Tomorrow. My name is Eric Carey, Chief Information Officer for Valley Health System. Today, I'm pleased to talk to you about our exciting new Footwall monitors in each patient room. It will provide the patient unprecedented access to information about their care, the care team, the people coming in and out of the room, and control of their environment in the room. The wonderful thing about this new facility, and one thing that everyone is excited about, is that we will have all private rooms. One of the technologies we've put in there is a pretty large Footwall monitor that's going to provide a lot of information to the patients. Why don't you talk about how that's going to help with the patient's healing process?
So the monitor that we have in each one of our patient rooms is a large monitor, and it serves a lot of different functions. There'll be an entertainment function as people are recovering through their care plan. There will also be an educational section where care teams can deliver videos to our patients and their families so they can learn more about what is happening, what is going to happen. They can do additional education on how to take care of themselves. One of the things I'm really excited about is that anytime a caregiver comes into the room, whether it be a physician, an advanced practice professional, an RN, a tech, environmental, food, they'll be displayed onto the digital board. Not just their name, but also their face, so you can know who's coming in to take care of you. That's also important for, if your family member was not there when your physician came in to visit. They'll be able to see, did the physician come by yet? And there'll be a record of who's coming to the room so that the patients and their families know who's coming to visit them. There'll also be the opportunity for our physicians and the advanced practice professional to share images with our patients and their families. So on this large screen, they can show exactly what is happening to the patient or what they plan on performing if it's going to be a procedure. So I think that'll be really, really exciting to have our patients and their families involved in that, direct visual care.
And now, let's hear from the subject matter experts to provide more details about the Footwall.
The Footwall will definitely transform tomorrow in that it is providing very relevant information for patients, families, and staff members at your fingertips. From a clinician aspect, it's going to take away some of those redundant steps that you need to do. Certainly the documentation is being done, you're manually updating grease boards, certainly you're having conversations with the patients, but this will allow for a lot of that work to be done through that digital whiteboard.
It'll really be able to update in real time, allowing for the nurse to then go in and to educate and to reinforce teaching or information that's really vital to the patient's journey.
They can really focus on the patient, the visitors answer questions, and really just jump right into nursing care without doing all of the documentation on the board to keep them up to date. It's all being pulled right in for them so they can really focus on being at bedside and being there for the patients.
The potential is really awesome for there to be just really accurate information for questions that families have all the time that create a lot of uncertainty and a lot of anxiety, like what provider has been in the room today, who's taking care of my family member, what test is coming up. These types of questions, those can all be answered by the Footwall, by the whiteboard. And so just a ton of valuable information that not having that information creates a lot of stress for families.
I see it really helping with transitions of care as well as just overall healthcare improvement.
We've been working closely with staff and with patients and families to determine how to best utilize this, this intense technology that we have available to us to provide meaningful information to patients, provide entertainment, and also to be a place where staff can get a quick look at some information when they enter the room.
It's really exciting to be a part of this project. I've never done anything like this before, and I don't think many nurses have ever had the opportunity to really look at your workflow, look at your unit, and see what changes you would love to make and throw those out-of-the-box ideas at whoever's listening and them actually take you seriously and review them and see what ways we can improve those processes. It's just been such a great opportunity for a nurse. I think it's everything that we've ever dreamt of, instead of kind of dealing with the cards that were dealt. So it's just been a wonderful, a really exciting process to be a part of.
The patient will be able to navigate to their education, to their entertainment, be it a television show or a movie that's entertainment package that's part of the system. They will be able to navigate to relaxation content. They will be able to do their meal ordering through that experience. And they'll be able to get information about not only the hospital, but that given unit.
The trick is to really leverage technology in a way that uplifts our humanity, right? We don't want it to distract from the patient. We want it to enhance how we can connect with people and how we can get a better view into their world.
I would really love to give a shout out to all the frontline clinical nurses and PCAs who attended many different workshops that we had. They really were very thoughtful and deliberate in their selection of different material that they wanted to translate over to the Footwall. And I think it was their expertise and their knowledge of their patients and what their patients may need. And that really helped design what we will eventually have at the New Valley Hospital.
Our amazing nursing care that we've always had will truly shine in the new facility. I'm really excited about that.
I think it's just so exciting to be on the cutting edge of how we can push technology to help our patients become better informed advocates of their care, or just participants in their care, and their family members advocates in their care. And I think, I'm really, really excited to see how patient education and patient care just is transformed.
I'm Kathy.
I'm Mason.
I'm Erica.
I'm Nancy, and together we are transforming tomorrow.